not this one. This one last year.
I've seen the bill without it, like $95. So.
My name is Celia Monreal, and we have Ambetter through the Affordable Care Act. This is my husband's bill from the clinic. With Ambetter, will no longer be accepted. Blood pressure medication, yes. And I've had chronic hypertension. I mean, if it goes down to not being on the Affordable Care Act, we would just have to completely cut the insurance, not even have insurance, you know, just go with the flow, you know. ¿Cómo es eso para ti?
Huh?
Con tus piernas.
And I see you have braces
Yes.
on your knees. Does that help?
My husband has, how do you call that? I guess degenerative cartilage from his both his knees. You know, because you don't know what's gonna happen. Yeah. And you don't want to risk your life, but you also don't want to, I'm dying, okay? My blood pressure is over. I see my husband in pain every day. Sorry. And I know he needs it, you know. He needs to see the doctor. He needs his surgery. And we can't afford it. I mean, even if we sold everything we have, we could not afford a surgery. This is a round shape. See the round?
Okay.
If I can pull it out.
What medicine is that for?
This is for my blood pressure. You see this? You are stuck between, okay, do I pay my electricity bill or do I go and see the doctor? Or do I buy groceries or do I go see and get this test done, you know?
I knew cuts were going to happen in different areas with the government. I knew, but I didn't know they were going to take our health care. I mean, this is big, and it's going to hurt so many people, so many. So I think Penny reached out. I got some correspondence from them, an email, a letter, probably yes too, saying there's going to be changes coming. Keep your eyes open, because then what will happen is after December, when it gets cut, my January premium will just skyrocket. They said there will probably be a 15% increase on plans across the board, plus lose subsidy. So my plan without the subsidy right now is almost $600 a month. So if I imagine that with a 15% increase on top, I don't know how anyone in my income bracket can afford to absorb $600 plus a month for healthcare and a healthcare plan with high deductibles and high copays. It's not even a great plan. You know, it's just so we have medical. I don't know. It just sucks. I'll go back to either being uninsured and paying cash out of pocket for doctor visits or medical, and then I say, well, what's going to happen like where I live? Here, we're in the middle of we lost like 4 or 5 hospitals. We're down to 2 hospitals in my area. That's it. And they're already overwhelmed. So then I'm thinking, it's going to go back to how it was when I was in my 30s, when people didn't have health insurance, before the Obamacare marketplace came into play. If you were sick or needed doctor attention immediately, you would just go to the ER. That was your only saving grace. I never did it, but people will do it. So now I'm thinking, what's going to happen in January when all these people lose their health care? We have 2 hospitals. So they're going to be inundated with people sitting there. It's going to be a bad scenario. This one's cool too. This one was little when I first got it. This one's like really big now. We're working, you know, I'm working. I I stand behind that chair 7 to 9 hours a day. I don't take vacations. I don't take sick days. You know, I work. And I tell people, like, I'm not asking for free. We just want affordable health care, you know, and that's it, just affordable, you know.